Kia ora, everyone. Thanks for joining in. We're going to crank into it. I'll get Al here just to share our screen, which is just going to give us a bit of an overview of what we've got happening on the session today. Before I sort of fully crank into what we're going to cover from a Webtools and Centrik perspective, wanted to actually just kick it off with Jeff. I know, Jeff, you were keen to say a couple of words just to kind of get us started. And I know this is, I think, the second Alex webinar that you guys have done as part of a series. So I'll let you kick us off and then we'll crank into our stuff, mate.
Okay. Hey, thanks for everyone joining today. This is our second webinar in the Alex series. For those who joined us last week, explain sort of the methodology and ideology behind Alex. Today we have Webtools with their Centrik platform. We're going to show two examples of this. One is consumer patient practice portal type application. We have the good folk from Better Health Group here as well. Thanks to the guys for joining me here today. And we're also going to demonstrate another use of how Centrik is being used for a heartbeat application, which is another use case. And part of what this whole thing's always been about is by using standards and using the FHIR API, IPS, it's enabled partners, and Webtools is one of many and ever growing ways of how do you use an API to deliver different business models. And I caught up with the Better Health Group this morning to see how things are going. You can see how this enables practices and organizations to look at different care models while using the same APIs. So they get the same answer when it comes to the patient data, but they can use that information in different ways. And this is pretty exciting and realizing a dream of a very long time of how do you provide innovation in a way that's not stymieing or stifling partners to be able to go forward. So well done, Webtools, well done, Better Health Group, but I'll throw it over to you, Harry and Al.
Thanks, Jeff. No, I appreciate it. For those that don't know me, I'm Harry Hawke and I'm the CEO of Webtools. Firstly, really excited to have the opportunity to come on and present what we've got to you guys. And definitely a big thank you for Medtech for all of your efforts over the past however many months, probably 18 months or 2 years, that this Alex platform has been a pretty big part of what you guys have been focused on. So thank you for all the work that you guys have done, and also thanks for the opportunity to come on and present. Also, just a quick thank you to our partners at Heartbeat. So we've got Murray Lilly on the call, and also our good friends over at Better Health for joining us on the session today as well. So we've got David, Graham and Siobhan on the call as well. We'll hear from them a little bit later. If we just to cover off just a quick agenda, so we have got pretty jam-packed session today, and we'll try and keep things moving. We'll try and keep things relatively concise and everything. It is being recorded, and we've got some time for Q&A, and we've also got opportunities for you guys to anyone that's got follow-up questions or interested in seeing more. We'll be able to touch base after the session as well to find a time to chat more. So we'll kind of rattle through it a little bit, and then if I believe Rawdon and Alex, if there are any questions, stuff can go into the chat, and we have got some time carved out to cover off at the end. So if anything crops up, definitely chuck your questions in the chat, and we'll try and get to them, and if not, we can follow up with you afterwards. So I guess getting into it. So just wanted to cover off Webtools, I guess, and who we are. Maybe a few of you have heard of us. Maybe some of you got no idea who we are. So Webtools, we're a digital technology company based out of Christchurch. We've got a pretty proud history of delivering digital tech solutions for the health sector over the past 5 years. And I thought this was a good opportunity to show our nice kind of cheesy photo of us all. We're the team that the development team but behind Centrik, and it's been a big focus for us over the last couple of years. And this has been one thing that we've done in amongst a whole bunch of other things. Again, I thought it was an opportunity just to kind of talk a little bit about some of the other stuff that we've been working on with a few of our other customers and partners along the way. I'm sure, like a bunch of you, we've got involved in quite a bit of COVID related work, which has been everyone's focus over the last 2 years. So I thought I'd give a little plug to our Ministry of Health project that we've done with them, the Athena application, which has been all based around COVID and making sure that health workers are well informed. So I know hopefully some of you have got this installed. If you don't, feel free to grab it. Free app, no logins required and everything. But yeah, just another wee example of some of the work that we've been doing and keeping us busy over the last while. So jumping into it, and a bit of a high level sort of broad brush overview of what Centrik actually is. So when we started the development of our platform, we had a couple of key aims, and that was really to remove any barriers and time and cost to deploy new and innovative healthcare solutions. We've got 3 key capabilities in the platform, and really ultimately what we're trying to do is make it easy for clinicians and patients, but the underlying theme at what we've got here is it's always integrating back with the source truth of the data. And like I said, big shout out to the team at Medtech who have made this a real possibility and reality from a general practice perspective. We won't cover the full sort of gamut of what we've got as different capabilities and modules and feature sets within Centrik today. And we're really going to be focusing on our PatientEx capability. As Jeff mentioned, we've got a couple of specific use cases to talk about. And then Al's going to take over from here and give you a proper sort of walkthrough and get into the deep dive of some of the feature sets later on. Probably just real quickly, and again, it's kind of hard coming into these sort of sessions where you don't know how technical or non-technical some people are that are joining in. This is in no real way a technical architecture, but it probably just provides a little bit of insight to how this is actually all set up and working in a pretty simplistic way. The Medtech guys have done a great job at removing the barriers and handling all of the complexity around their own different sort of flavors of Medtech, and been really crucial for us to ensure that we can connect in and integrate with a single point, which is the Alex platform. But everything that we're talking about here today does cover the sort of full spectrum of Medtech PMS, which is great. And Jeff sort of referenced it earlier on. So for those that are hot on standards and interested in what we're kind of doing under the hood a little bit as well, is that both Medtech and Webtools have adopted the FHIR HL7 international standards. So right throughout this process, it's based on international standards, which make it really easy for all of us to work with. Makes it easy for Medtech to develop new APIs and endpoints for us to talk to. And it means that everything's standardized, so we can turn those endpoints into end features and end value to patients or the GP teams pretty rapidly. We have now currently 3 patient-facing or consumer health apps on the stores, and they've been configured and deployed for a couple of different use cases, and some of those is what we're going to cover today. These are currently live and out there. They are on an invite basis at the moment, so it's really just when practices have deployed it or we've got all of the plumbing and stuff hooked up on Alex and we've got the consenting sorted that we can then invite the patients to use this. So they are there. If any of your patients are part of the Better Health group or anything, then you can absolutely connect through and start using it, which is great. We've gone live at the start of this month in terms of actually rolling out to Better Health, which is great. So we've got a rapidly expanding sort of user base, which is great. And we'll get to that a little bit more later on when we sort of talk about our implementation and where we're at. So first off, we wanted to touch on use case number 1, which is the Heartbeat Health app. And I'm going to pass over to one of the co-founders, Murray Lilly, just to cover off the Heartbeat use case and how that's working. Thanks, Murray.
Yeah. Hi. So I'm one of the founders of Heartbeat. Now, Heartbeat is fundamentally a travel wallet, and we've been working on this for a few years, actually. We were in a very good position to go live 2 years ago, then COVID came along, so travel insurance has been bleeding to death. But yesterday I was talking to our customers, and the travel insurance sales for March this year is about a 4-year high. So the latent demand is going nuts. So the whole idea of the travel wallet is the key points down there on the left is it's a repository which is both accessible off your mobile device or through the web for your key travel documents. So a lot of countries now are asking for proof that you've got travel insurance. Thailand's one of them. Quite a few countries in Southeast Asia do now. So you can display the relevant documents off your mobile device in the country where you are. Also means if you lose them, it's very easy for get temporary travel documents to get out of a place. The key thing is around emergency assistance and the triage information available by the patient. They can actually share that information with whoever they're talking to on the phone. So the travel insurers provide a list of all the toll-free numbers that you can call in most countries, and you'll get a centralised medical professional to be able to triage your situation. And if they have access to your medical health summary, it makes it a lot easier. Pre-COVID, about a third of all medical inquiries around assistance was to do with lost their medications, run out of medications, or took them out of the wrong sequence. And if you were in America pre-COVID, it could take 2 weeks to get your medications replaced. But with the Heartbeat app, you can get it in 2 hours, which is a dramatic change for the travellers. So the health summary is a pretty standard health summary. It's almost like a warrant of fitness to travel. It's effectively details of the practice that you belong to, details about the patient around that. It has basically immunisations and allergies, current medications, current conditions under management, the latest BMI and heartbeat and blood pressure readings, and the latest pathology results. So it's really just like a warrant of fitness. This is what I've got, where I'm at, and it makes it easier when they're dealing with people in foreign countries if they need assistance. And the last feature about the app, it allows the user to make a claim online with the insurer. So if you lose a phone in Uganda or have a medical event, historically what you have to do is wait till you get home, fill out the forms, and then make a claim, and any medical costs you tend to have to pay up front. Now, a couple of the insurers have got relationships with medical providers in the countries, quite a range of countries now, that if you have this app and you're claiming online, they pay it to your credit card. So you don't have to wait till you get home. So it's all about making it easier and safer for travellers. So that's fundamentally what Heartbeat's about.
Great. Thanks, Mars. Appreciate that, mate. And I guess for those wanting to grab any more specific information about Heartbeat, I don't think we actually listed on here, but we can fire it out. Heartbeat.nz, I believe, is the domain URL to go and check out more about that specific sort of solution. Thanks, Murray. Okay, so now, yeah, we really want to do a bit of a deep dive into the applications that we've got for general practice. And I thought before we kind of get into the fun stuff and having a look at some demo videos and everything, I thought it was probably quite good to sort of highlight a few of our kind of motivations and what we're trying to achieve, and some of our principles as well. And hopefully that comes through when you sort of see the product and everything as well. But one of the fundamental things that we wanted to look at was that sort of digital journey and the digital experience that patients have whenever they're interacting with their general practice, whether that be for just updating their information or arriving at the clinic or requesting a repeat script or whatever. We wanted to look at the real end-to-end interaction and come at it from how can a digital solution support or facilitate each step of that sort of journey. Another really key sort of fundamental is that we wanted to deliver, a modern and familiar user experience and interface. We know people are using their banking apps and everything, social media, day in, day out, really regularly. And we wanted to make sure that our experience that we were delivering was familiar. So there's some real sort of key tangible examples that you'll see in the demo, using the likes of the native biometrics for Face ID and Touch ID and those sorts of things, just to make it, as I say, a familiar and easy experience for them. We've been really trying to make sure that we're developing this in collaboration. We wanted to avoid building something, in our dark room here in the office and then unveil it, 2 years later and hope that it kind of hits the mark. So we've been really working hard in collaboration with practices and patients, and we know that there's a range of stakeholders across practices from the GP themselves to the administration team to any sort of operational team and people as well. So we've been really trying to make sure that we're capturing the pain points and capturing the opportunities to build into our end product. It is all ready to go. It's live, and we'll get to that a little bit more. So it can be turned on and trial with minimal effort. I sort of touched on it before, but the Medtech guys have done a really good job with Alex, and a lot of that can actually just be enabled remotely. Not a lot of effort really required by the practice at all, which is great. So we've, as I mentioned earlier on, we've been trying to look at how we reduce the barriers and the cost and the time and the effort to implement some of these things. And just to touch on, so I think when Al does his demo, we've got sort of two brands in play at the moment that they're effectively the same app, but we do recognize that there's a desire for some of the larger GP groups and people that are trying to build and give a really consistent brand experience as well as part of operating a GP group. So we have got enterprise options, which actually give a fully branded experience for the patient as well. So hence why you might see a couple of different color schemes and stuff coming in, but all effectively the same capability and same application, just there might be some slightly different config in terms of how that's been deployed for the Better Health group. Just to follow on from the deep dive, and I won't get too deep into this because I might steal a bit of Al's thunder, but yeah, I just wanted to sort of show a bit of a laundry list of the feature sets and the features that we have got. I guess coming at it from a perspective at looking at the patient journey and the patient interaction with general practice, has kind of meant that a few of these kind of features have almost kind of fallen into their own categories as such, and also might extend a little bit beyond what maybe we've all sort of previously thought of as a patient portal. Yeah, I won't delve into this too much, but yeah, Al's going to be covering off these features as he goes through. So I think that's it from me. Without further ado, I'll hand over to Al for the grand show.
Yeah,
he's been praying to the demo gods. I think they've done some pre-recorded videos to help him out.
Yeah, you'll forgive me not to be doing a live demo. Experience teaches me that it's best to have these pre-recorded. So my name's Al. I've been working with Webtools now for just coming on 18 months, and I've had the privilege of actually coming in at the ground floor when we started on this PatientEx and ProviderX journey. And also with Better Health Group. So got in touch with them early on in this journey, recognizing that what we were doing here has a direct impact on both general practice clinicians, primary care, the patients, but actually the broader health system as well. Just a little bit of context here before I get into the demo. I mean, we know a lot about the current context out there. It's not easy. We've got general practice teams that are stretched. We've got 15% more patients being seen this year than last year, and those patients are more they're of higher acuity with increasing complexity. We've got a third of GPs now rating themselves as high on the burnout scale. We've got understaffing, and particularly problematic in rural. We've got low margins at general practice. They're trying to maintain their revenue with increasing operational costs. The common funding model constraints. So, we may be implementing new digital technology and innovative ways of delivering care, but we need to be able to match the funding models to that technology and that new service offering and delivery. Protecting staff. I mean, that's come to the fore quite acutely with COVID, and making sure that the staff within a general practice, as well as those patients attending the general practice, are protected. And then we have that constantly changing landscape, and COVID really has highlighted that. So we've got traffic lights, we've got alert levels, we've got RAT testing, we've got vaccination, COVID vaccination centres that general practice groups have had to rally to get quickly established, and that's all within their standard operating BAU. I'm not quite sure how you guys have all done it over the last 18 months, but I know it's been a Herculean effort, and hats off to you all. So that's a bit of the motivation behind us, is to try and make life frictionless, and that's frictionless not just for the patients. This is for patients, this is for practices and the practice teams, as well as the broader health system. So without further ado, I'll get into some of these demo videos now. Kicking off here, we've got, I'll start off with just a standard patient registration. Now, as Harry mentioned, we have those two brands. So I'll kick off with our Webtools brand. So starting off, we have a single instance multi-tenant set up for those who like the tech talk, which means we have an invite code, and that invite code sets you directly to a particular tenant within that instance. We have standard registration details. Now, when we fill out this form, we're actually matching on surname, date of birth, and mobile number, and it needs to be a direct one-to-one match with the record details within the PMS that we're connecting to. So we're sending this information through Alex directly into the patient management system and returning that. We've got standard read terms and conditions. I won't bore you on all that, just to highlight that it's there and that's configurable. We have to accept those terms and conditions before we progress to the next step. We've got standard multi-factor authentication, so we're verifying that you have that mobile device that matches with the mobile number in the practice management system. We've got a PIN number, confirm that PIN, and then we enable Face ID or touch recognition if you don't have the face recognition on your device. We can allow emergency access. So this is actually giving consent for the information in your app to be visible through the web portal, and that's part of the offering with Centrik. We search for our general practice. So we've got our demo general practice here, connecting through to that, but this is through through Alex. Continuing, we finish to confirm that those details are correct. And what we're doing now is polling Alex straight through to the PMS and returning the patient health summary record. There we go. That's number one.
Only got 2 doses, mate.
That's 2 doses. Before I get into the COVID card, I'll just show you rather than having to remember your username and password, you can see we've enabled that biometric login. So we don't have that challenge of having to remember those anymore. We can use either your PIN ID or biometrics to log in directly after you've closed the app. Now I'll just give you a quick overview of the app itself. On the landing page, we've got the COVID-19 vaccine record at the top. So we actually introduced that pretty quickly. Ooh, sorry, go back. Skipped ahead. Apologies. Getting out of sync here. Let's try that again. So we've got our COVID-19 vaccine record. When we implemented this with the product, that was back in the days where we had the paper-based records, and we thought we can probably do a better job than that. And so what we did was enable that. Now what it's doing here is pulling that information directly from the immunisation details from the PMS and just filtering that as a COVID record card at the top. You can see the health summary information down below. Each of those different cards is a different different conditions or different criteria within the international patient summary record. Down the bottom, we have medications, appointments, and settings, and we'll get to those, each of those in its own separate video.
You thought you were going to talk longer.
I thought I was going to talk longer. That's clear. These videos are a case of just in time. And down the bottom, we've got my data, my documents, and information. Again, we'll dive into that soon. If I can skip ahead here. Okay, so each one of these different cards we can drill into. So we've got conditions as a starting point. I can select on conditions. You can see each of the different conditions that have been pulled back from Medtech through the Alex platform. Details about notes, who they were recorded by, date recorded. And that goes all the way back. So that's all conditions that are associated with my patient record. Immunisations, again, this is all immunisations recorded against my patient record. Details about the notes, the route, etc. Medical warnings, some strange medical warnings in this record. I'm not entirely sure. I clicked on penicillins because at least I knew what that was. These are the details here that are recorded on the general practice system with against my record, not those that were registered when I signed up for the app. We have consultation notes. You can drill into each of those, and that's consultation notes from the last 2 years only. It's part of the filtering on the patient summary record. Measurements, again, those recorded in the last 2 years. Lab results. This is a neat one. Again, last 2 years of lab results. Now, these are lab results that come into the GPM box that have been observed and commented on by the general practitioner and then filed away. They present once they've been filed. Next, we'll move on to medications. So this is a new feature. Medications here, we've got the last 12 months filtered at the top with an option at the bottom to select all medications. And this is all medication that has ever been prescribed for me, and it's a long list.
I don't know if you said it, this is obviously all test demo data.
It's all test demo data, yeah. So here we can drill into each of those cards, but what we can also do now is select one of those medications, one or more of those medications, and order a repeat prescription. So we've got some details there, some of which are long-term, not long-term medications. We have some that have been prescribed within the last 3 months already as flags. I can select those medications. I can put a comment against them if there's a star. For example, if it's not a long-term medication, or this was Ventolin was prescribed less than 10 weeks ago, then maybe I put a comment associated with that. So when I submit it through to the general practice, they have some context as to why I'm asking for another repeat for something that's already been prescribed. An option of selecting pickup at the pharmacy of the prescription or at my general practice. I'm up in Auckland, I think, at the moment in this demo. So I can do a search for, oh no, I'm local. Search my local pharmacy. I can select that pharmacy and continue. And then I have some details just around the service fees and processing times associated with this request for a repeat. And off I send. Once I've sent that, that sends as directly through Alex and lands in the general practice inbox to be sorted with the standard business process within that general practice. Next, we'll move on to booking appointments. At the top, we've got our practitioner. It defaults to my registered practitioner, but I've got the option there to select a different practitioner if the appointment slot available doesn't suit me, or I have a reason to see someone else. We've got the calendar, and you can see the little numbers associated with the dates to indicate how many slots are available. These are the slots that are enabled within Medtech, so we're pulling that data back and presenting it. We can select that appointment slot, confirm the details, where I'm going, who I'm seeing, what time and what date. Confirm that, but then I've got, again, as Harry mentioned, we've got the local in-app features where we can select to add to our own calendar if we have it as part of our standard calendar functions. We get notifications once we've booked that appointment. So within 30 minutes of that appointment booking, I've got the ability there. It launches on the lock screen. I can launch into the app, go into my appointments, and check in. So when I check in for this appointment within that 30-minute window, I get prompted with some screening questions. I can confirm that I I don't have any symptoms, or I don't meet any of these conditions, and then I can proceed to check in. Once I've confirmed those details, I arrive myself, and that updates the status within Medtech. I can also cancel that appointment. It's a simple, yes, I want to confirm. and that appointment no longer exists, and that's updated back in Medtech as well. We have My Documents feature. This is one that's consistent with Heartbeat, so I can actually upload documents either directly from my photo gallery, or I can take a photo or a PDF if I have something on file on the device. Now, this information can be viewed both through the app, but it's also shared with the web console for the administrative staff and the clinicians. We also have a new feature called Information. What this does is from the web console, you can configure different headings and different publication types and set those web URLs. So each one of these different URLs, and they present as a web view within the app. And those are all configurable from the web console by the general practice team, if they have the permissions. And you can present the information that's relevant to your patient or consumer cohort. What we've got here is a bit of a sneak peek at the web console on the left-hand side. And on the right-hand side, I've got my appointments booking. So I'm just going to take you through some of the features here. It's a small feature set at the moment for the practice team, but here we've got on the left-hand side, the practitioners that are available to book against in the appointments on the right-hand side on the app. So I can save those in the web console. Then try and book another appointment through the app, and I can see a new GP, Dr. GP is available, and the nurse is no longer available to book against. This is just a bit of a sneak peek at the what I was talking about earlier around the information. So I'll actually fast forward some of this, but we have the links there. We can select the icons for the categories. You can select the title there. So COVID information.
Just to clarify, Al, these are some of the sort of configuration and administration tools that as a general practice team or operations team can use to deliver the app experience that they want for their particular site. Yeah,
absolutely. So it avoids the need to have to go and log a support request or deliver a new app build. These are all configurations that can be done from the web console by the practice team. And then you can see on the right-hand side in real time those new headings and publications present, and then you can display the content within those. This here, I'm going to show you a new feature here. We've got on the left-hand side, we've got Webtools Medical Center, but we've actually configured a series of different teams here. So we've got district nursing, pharmacy, physiotherapy as another use case, and I can switch between those teams as a clinician. So on the bottom left, you can see a clinical role, and I can see when I register with the app and I select that invite code, that assigns me with a team. And what we're looking at is different use cases now for how we can associate that patient with a particular team. On the right-hand side, I've got associated with 4 teams, you can see here, for the demo patient. What I'm going to do on the left as a clinician, I'm going to access that record. So I'm currently in the Webtools Medical Center. I can drill into this. I can return that same patient health summary record as the same details as presents in the app for the patient themselves or the consumer themselves, and drill down into each of these. I can open up those cards and present some of the details and via a web view. I'll skip ahead a little bit here, but on the right-hand side, when I scroll down now, I can see that has been updated, refreshed, pull down to refresh, and you can see that is accessed just now. So the consumer or the patient can now see that their information has been accessed. I'm going to switch over to the pharmacy view. So I've enabled this particular patient to be associated with multiple teams. So they visit their pharmacy, the pharmacist can now drill down and see that information. On the right-hand side, I can see that's now been accessed. What I have the ability to do as the consumer is to revoke that access with a toggle. And if I go back into that record as the pharmacist, health summary is no longer available to the pharmacist. You can still see the registration details and any documents that have been shared, but can no longer view or access that clinical information. I can turn that toggle back on, and in real time that will become available once more. Finally, we do here, what do we got? I'm going to show you, so this is one of our ProviderX functions. So Harry talked about the use case being PatientEx, so an app for the patient consumer with the corresponding web console for general practice. What we have here is one of our first features for ProviderX. So what we have on the top right-hand side where my cursor is a add patient button. So what I'm going to do is I'm going to click that as a pharmacist. I'm going to do an NHI search for a patient who's presented to me, and I'll have that NHI information because they're going to present to me with their script. I'm a healthcare provider providing care for them. I'm going to select the facility that that patient is associated with. Oh, Jeff, that's you, mate.
This is definitely different.
Jeff's going to give me consent as the pharmacist to access this information. And here we have that information returned, international patient summary now available to the pharmacist. One of the use cases there that we're looking at is for a pharmacist to be able to access this information to help inform some of their clinical decision making, whether it be vaccinations or whether they have some questions, for example, around one of the prescriptions that if they had access to this information that may provide that context and avoid a telephone call to reception at the practice team. And a bunch of wait time and wasted time for both the pharmacist and the consumer. What I have here is just an example. If we look on, this is my phone with a few different apps. We've got test and stage, etc. We've got production ones there as well. But you'll see the Better Health logo there too. So I'm going to launch the Better Health Outcomes app. So this is the production app with test data. You see at the top is a starting point. It's kia ora is my greeting rather than hi. So we've got some language strings here where we can change the language within the app. So we've got English te reo translations now as out of the box. We will be building out that feature set for broader internationalization. The cards you'll see under GP Health Summary. I have medications there, which you didn't see before because Better Health Group haven't yet launched the medications module. So we're just deploying that into production for Better Health today, subject to release from the web console. We'll drill into some of these cards and you can just see again the English te reo translation at the top. And down the bottom, you can see that the information hasn't been enabled yet either. So that at a console level, we can turn on the medications for a particular tenant. So we can turn medications on and off. We can enable the information to present and shuffle and display the different components within the app, depending on the needs of the practice. Now onto a little bit, just a touch on what we've been doing with Better Health. We launched at the start of March. Now launch is really a communication strategy. We did go live with Better Health in December last year, and we went through a series of beta tests. So we were connected to Alex at the end of the year already. We had test patients within each of the practices within the general practice group. And we were able to connect the production app through to those and do our first sort of round of beta testing and general practice engagement to get the practice teams on board. They've had a lot of experience with rolling out patient portal apps and other technology in the past and have had various levels of success and challenges, and trying to do this in amongst all of the other demands on general practice during COVID and the different alert levels and the rat testing and the COVID vaccination centres and things that I know Better Health Group have been heavily involved in. It's not an easy time to be rolling out a new piece of software, so there needs to be a compelling case for the value that it's delivering to the practice group. But that's been evident in the uptake. So we've already had 18% uptake in those that have been invited. which we're really blown away by and really excited by. And that conversion rate from those who have been downloaded the app to actually registering with the app is knocking on 90%, which again is a testament to how keen people are to actually have this technology. And we've kicked off a kind of consumer advisory group as well, and we've had 160 contributions now already, with about half of those will be actively followed up with for ongoing interviews and contributions to our product strategy and product design. It's pretty exciting. But maybe it's a good time now to hand over to David and Graham and Siobhan. I think Phil's on there too somewhere. They've all been heavily involved in the rollout so far. Maybe just for a comment or two on how things have been going from your point of view.
David's looking for the mute button.
Find the mute button.
Yeah, sorry. Got it. Found it. Thank you. I'll actually get Graham to launch, because ultimately this is a clinical tool. This is about patient care and the patient journey.
So I'm Graham McGeoch. I'm a general practitioner and involved with both Better Health Group and with Webtools. I've been involved with a number of portals over the years, and none of them have proved particularly brilliant. So was excited to be involved with this opportunity, and so far it's proving extremely satisfactory. At the moment, it does most of the things that the existing portals do, and we've described the repeat scripts and the appointments. But where we anticipate that it will go is doing things like re-enrollment, so people can't drop off their enrollments. And more exciting from a clinical perspective is hopefully to get into more automatic, systematic care with lots of tasks and reminders to patients, so that a lot of the basics can be done more reliably than we've been able to do with what are often quite manual recall systems. If we can do it through the app, I think we'll be able to make it much easier. And then future care planning, not just advanced care planning, although that's very important, but also acute care plans and more longitudinal care plans for patients. And not shunt so much information around. So maybe referral can become a simpler process over time. So that's where I see it going, and our experience so far very easy to get onto it. I'm completely tech savvy, keep losing my password, and I've managed to regain access to this thing a few times as I've repeatedly tested the new features that Webtools roll out. David and Siobhan, have you got other comments?
Probably at this stage. So I'm David Jones, Managing Director, CEO of Better Health Group. I suppose our interest in this was really piqued by the lack of take-up of a couple of portals that we had tried, and looking at this, as Graham said, this is part of the journey. How do we utilize technology to engage the patient in a journey that intimately involves them and yet has been done unto them for many years? We're trying to look at how we move the spectrum from care being given to patients fully involved, and there's a wide spectrum there. In terms of the rollout, I'll pass back to Phil, who has been rolling out the practice, but I'd like to just add a couple of very recent anecdotes that have been quite fun. The first one was an 80-year-old ex-practice nurse who ended up phoning me because she was uncertain about what a special character meant for her password. And it was just delightful to hear this wonderful lady just saying, oh, like how everybody needed to get on the program, get onto the technology and get with it, which I thought was just wonderful from an 80-year-old. And I think the second anecdote in terms of delivering on some of on an expectation was a patient yesterday who turned up at ED with her phone, anxious, with a heartbeat and a level of anxiety and breathing where she couldn't speak. So she simply handed over her phone to the ED doctor, who then scrolled through it. And she phoned the practice later on that day just to say thanks. This was brilliant. It worked really well. So a couple of very early on sort of practical examples, which we're delighted with. I have to say, delighted. So at this point, probably hand over to Phil in terms of the rollout and the process of the rollout. Excuse me, I'll just kill that.
Are you there, Phil?
Yeah, kia ora. I was just waiting for that that message bomb to pass. Hi, so I'm Phil. I'm a marketing coordinator at Better Health Group. So yeah, I've been heavily involved along with Al and Bridget at Webtools with rolling out to our practices, which we've got to 5 so far. And I mean, you can see on the screen, the uptake has been really impressive and really promising and validating, I imagine, and fantastic to get some feedback as well from patients, just actively saying, hey, it's brilliant to be able to see all this stuff right in front of me, easy to access. I think, as has been mentioned, some of the practices at this moment in time are the most stretched they've ever been, under the most stress that they've ever been, and coming to them with a new product and saying this is coming out, and that you know there's the apprehension, and there's what is you know, what does this mean for us? What do we have to do? How is this a new job? And there's questions. What if this goes wrong? What if that goes wrong? And every single time, it's been fine. It's just, you know, we're sort of operating on that no news is good news. And for all of those apprehensions at the top, there have not been complaints coming through the back. So really smooth so far, and really excited to see what practice 6 and 7 and 8 and 9 are going to look like.
Brilliant. Thanks a lot, Phil, and guys over at Better Health HQ. Yeah, I'm not going to forget the email I got at our first practice we rolled out, and that was Moore Street and Ashburton. I got a message from the practice manager, the account, who's been heavily involved in the rollout and engaging the other practice managers across the group. You know, I got just a one-liner message from her. Someone just arrived themselves from their car. So cool. And to hear that when we put so much effort into this, and to hear the feedback that we're getting like this, it is very validating, and something we've been really proud of, and something we're just at the start now, and really looking forward to where this can go. So on that note, where this can go. Questions. Before we kick into the question, you can see we've got a little QR code here. If anyone is interested in actually a more in-depth demo of the product and conversations with myself or Harry or John or any of the team here, you can just scan the QR code or go to that link. There's a couple of URLs down below as well, but the link in the QR code will give you an appointment slot where you can book some time with us, and we can give you a run through directly. But on that, yeah, open up to questions. I think we've got some here.
Yeah, I don't know if we can actually. Oh, we can see.
Oh, there we go.
Cool. See how much time we've got. Yeah, we've got about 8 minutes. So the first one there is this similar to Manage My Health? Yeah, it's probably a question we get quite a bit, to be fair. And as you may have taken away from some of the feature sets, there's obviously a lot of crossover there in terms of the feature sets that are on offer. I think probably, I mean, even coming back to the implementation side of things that Philip was talking about and the apprehension around stuff, a really important thing to note is that this isn't either that or that solution. This is actually still running in parallel at the sites of Better Health with Manage My Health. Most of that's just around making sure we're not turning things off or disrupting patients for what they've been used to. So there's probably a bit of a sort of staged out sort of rollout, which we can do. So in the sense that it's a patient application or a patient portal type feature set, definitely similar to Manage My Health. As I touched on earlier, I guess we've sort of tried to come at this from an end-to-end experience, and I guess one of the examples being is that we've tried to look at, okay, what does the patient experience look like when they actually are arriving at the practice, and Al talked about that use case right there around someone needing to check into the practice and maybe update their details or whatever it might be. And we sort of worked out, do we want to have some sort of kiosk sort of type solution, so when people were turning up to the front door that they can actually start interacting with the practice as well. And probably one of the key sort of extensions that we've done onto the product is enabling those kiosk type features. So checking into the appointment, updating your details and your demographics, and receiving some other sort of information out to your patients, is that we're actually enabling all of that through the patient app. So it doesn't matter if the person's checking into an appointment from their couch because it's going to be a virtual appointment, or if they're checking in from their car and need to do a COVID screening sort of questionnaire. We've actually enabled all of that through the actual patient app, which is quite cool. So thanks for your question, Corey.
Just a couple more points on that with our solution is that we're obviously integrated using fire standards, the fire standard APIs through to Alex platform. So we're not wedded to any particular patient management system. We can plug and play with any system that presents the APIs. And that on that note, it means we can run things in parallel. So it does allow the provider practice the opportunity to try our product without having to switch off another product, and so it just reduces the risk there for them.
Yeah, cool. Thanks for your question. Looks like I've got another one from Kate Armstrong. It's a very wordy question. I'll see if I can quickly skim read it. What if the patient is seeing a naturopath and advised to take some natural treatments and wants a GP team to check if these are safe? It's probably quite a specific question around a clinical workflow there that I don't know if I'm the best person to answer, to be honest. Maybe that sort of idea, got brought up maybe around Al's example, where you might have a pharmacy team looking to interact with the GP record in some way. If in theory, the way in which the application can be set up and everything is that the patient themselves can actually choose to share some of this data with their care team, whether that be a parent or whether that be the pharmacist or whether it be a naturopath potentially. I'm not sure, Graham, if from a clinical perspective you might want to take the lead on that one, because I'm not sure how that would actually work in general practice. And if that's a question that's worth covering off.
I'm not sure I can.
I'll have a go. I'm not.
Right, go on.
I'll have a go. So it's an important part of the Alex API is authorship around the author of data. So when there's a third party, like a naturopath, generating information, there's a lot of interest around how this should be handled from a GP perspective, from a practice perspective. And so far, our view is that a lot of the practices want to have a say what goes into that GP record, because it's got to be linked to an author. So in that use case that Kate's bringing up, the way you would probably do it for real is if a patient was on some medications or naturopathic medication, they'll bring it to the GP and discuss with the GP. Now, if the GP wants to add that to their record, that's where that thing will start to come into play. So we are doing a lot of work talking with clinical groups around how do you get information back into a record, and that's the authorship as well as acceptance of it. And you get into things like drug interactions, for example, or allergies. Again, where did that information come from, so that there's clear ownership or responsibility, I suppose, for that data as well. But it's a work in progress.
Thanks, Jeff. Good work. Last question that we've got in here is from Darren. So what is the pricing model? Yep, good question. So our pricing model is by a feature set basis and is also by a per enrolled patient basis as well. I mentioned earlier on that we do have a fully branded experience and enterprise sort of implementation of this as well, which has some additional sort of setup and some additional costs for running that dedicated branded app as well. Yeah, we can cover that off if you're interested, Darren. We can happy to kind of book a bit of a demo and talk you through your specific sort of use case and what the pricing might look like. That's all we've got on the live chat, and
2 minutes left.
2 minutes left. Good timing, everyone. Nobody spoke for too long. That's good. So I think that's it.
I'll just say, yeah. Can I just say, hey, thanks a lot, guys, for putting that out there today. And thanks to us, the Better Health Group. We're seeing innovation live and real, which is pretty exciting. And I think it shows a good example of ingenuity that can come out of this. There's a lot of capabilities that you can leverage off these APIs, and it's limited by the imagination. And as we mentioned in the previous webinar, there's a roadmap to expand that API into other areas. And I'll say this, people using the APIs and using them will help shape how those APIs are being used and developed in the future. So I encourage all parties and partners to work with the Webtools of the world to sort of challenge the way that we can do this in a nice, innovative, responsible and permissioning way, so that we are having the terms of confidentiality and privacy, while at the same time getting a lot more of efficiencies. And that example of checking into the car park, 2 years ago, you would never have thought that you had to check in the car park before going into medical practice. That is a real live innovation that we now face in the modern world. Thank you so much.
Thank you, Jeff. Thanks for those comments, and Peter Jordan, thanks for your comment there. I know you've been a big part of some of the work that's gone in and to Alex and the standards, and yeah, big thank you to Medtech again for giving us a bit of your time, and thanks for everyone else for giving up their sort of lunch hour to join us on here and have a look at what we've got. So look forward to hopefully catching up with some of you all very soon.
Thanks so much, guys.
Yeah. Take care, everyone.